Welcome back to Cancer is a Mitochondrial Metabolic Disease Basics. You could be eating what seems like a ketogenic diet, keeping your carbs extremely low, and still not actually be at the level of ketosis you think you are. So how do you know if you're truly in ketosis? And more importantly, whether you're reaching a deeper therapeutic range? In this video, I'm going to briefly recap how ketosis works, then show you how to measure it in the real world using blood glucose and ketone measurements. We'll break down the Glucose Ketone Index, or the GKI, exactly how to calculate it and what the different ranges mean, and why looking at glucose and ketones together can give you a much better picture than one number alone. By the end of this video, you should be able to look at your own numbers and understand exactly where you fall metabolically. So without further ado, let's get into it. So today, we're going to look at how to know if you're truly in ketosis. And in the last couple of videos, we've talked about what ketosis is, what ketolysis is, what ketogenesis is, and where the sources of substrates come from to make ketones. We looked at what a standard diet versus a standard ketogenic diet versus a therapeutic ketogenic diet macronutrient profile could potentially look like. We talked about how certain foods will increase insulin signaling, and insulin signaling is the switch to turn ketones on or off. And then we touched on how a lower glucose ketogenic type diet would be important for removing available substrate in the form of sugar to the cancer cells so it can't have access to the fermentable fuels to make lactate or energy or biomass. And we also then talked about how it's more than just that. It's actually the fact that you're not having a higher insulin situation or a higher IGF-1 signaling, which is effectively the gas pedal to grow cancer. So now we're going to be talking about, again, are you even in ketosis in the situation that you're currently in, how to know that, and how to track it. So I'm going to start out by referring to a paper that was published in March of 2015 by Seifried et al. And it's titled The Glucose Ketone Index Calculator, a simple tool to monitor therapeutic efficacy for metabolic management of brain cancer. And it says here in the abstract, metabolic therapy using ketogenic diets is emerging as an alternative or complementary approach to the standard of care for brain cancer management. This therapeutic strategy targets the aerobic fermentation of glucose, Warburg effect, which is the common metabolic malady of most cancers, including brain tumors. The ketogenic diet targets tumor energy metabolism by lowering blood glucose and elevating blood ketones, beta-hydroxybutyrate. Brain tumor cells, unlike normal brain cells, cannot use ketone bodies effectively for energy when glucose becomes limiting. Although plasma levels of glucose and ketone bodies have been used separately to predict the therapeutic success of metabolic therapy, daily glucose levels can fluctuate widely in brain cancer patients. This can create difficulty in linking changes in blood glucose and ketones to efficacy of metabolic therapy. And it says a program was developed, Glucose Ketone Index Calculator, that tracks the ratio of glucose to ketones as a single value. We have termed this ratio the Glucose Ketone Index. The Glucose Ketone Index Calculator was used to compute the GKI for data published on blood glucose and ketone levels in humans and mice with brain tumors. The results show a clear relationship between the GKI and the therapeutic efficacy using ketogenic diets and calorie restriction. Conclusions. The Glucose Ketone Index Calculator is a simple tool that can help monitor the efficacy of metabolic therapy in preclinical animal models and in clinical trials for malignant brain cancer and possibly other cancers that express aerobic fermentation. So in the paper, it says therapies that can lower glucose and elevate ketone bodies will place more energy stress on tumor cells than that of normal brain cells. The therapeutic strategy is illustrated conceptually in Figure 1 as previously described. However, daily activities and emotional stress can cause blood glucose levels to vary, making it difficult for some people to enter the predicted zone of metabolic management. A more stable measure of systemic energy metabolism is therefore needed to predict metabolic management of tumor growth. The ratio of blood glucose to blood ketone bodies, beta-hydroxybutyrate, BHOB, is a clinical biomarker that could provide a better indication of metabolic management than could measurement of either blood glucose or ketone body levels alone. And it says here in the methods, the Glucose Ketone Index, GKI, was created to track the zone of metabolic management for brain tumor management. The GKI is a biomarker that refers to the molar ratio of circulating glucose over beta-hydroxybutyrate, which is the major circulating ketone body. A mathematical tool called the Glucose Ketone Index calculator was developed that can calculate the GKI and monitor changes in this parameter on a daily basis. The Glucose Ketone Index calculator generates a single value that can assess the relationship of the major fermentable tumor fuel, glucose, and non-fermentable fuel, ketone bodies. Because many commercial blood glucose monitors give output in milligrams per deciliter, at least in the States and some other countries, rather than millimolar, the Glucose Ketone Index calculator converts the units to millimolar. Included in the program is a unit converter for both glucose and ketones, beta-hydroxybutyrate, which can convert glucose to ketone values from milligrams per deciliter to millimoles, and from millimoles to milligrams per deciliter. The molecular weights used in the calculations for Glucose Ketone Index calculator are 180.16 grams per mole for glucose and 104.1 gram per mole for beta-hydroxybutyrate, which is a major circulating ketone body measured by most commercial testing kits. The unit converter allows for the compatibility for a variety of glucose and ketone testing monitors for basically people around the world. So this is the calculator that was included in this paper, and I'm going to just show this for showing its sake, but I'm going to highlight that on Keto Mojo's website, they actually have a calculator that's done for you. You plug in your glucose number in milligrams per deciliter, and you plug in the ketones and millimoles per liter, which is what most of these ketone monitors actually check for. And then you push calculate, and then boom, you're done. Now, if you're in a country where you're measuring blood glucose in millimoles, it's actually very easy. Glucose over ketones, and that's it. You can still use a calculator to figure it out exact numbers, but my point is it's much easier. So how do we know if we're actually in ketosis or not? So I pulled this graphic from Keto Mojo's website. There's other graphics similar to this, but this was helpful. So if it's above 9 or equal to 9, you're just not in ketosis. That means the glucose is high, insulin's high, ketones are turned off, and therefore you would not expect to be in any level of ketosis with that situation. If it's 6 to 9, that's considered a low level, 3 to 6, moderate, 1 to 3, high level of ketosis, and less than 1 would be the highest, most therapeutic level of ketosis. And then it actually gives some difficulties. So they're saying, 6 to 9 is kind of like weight loss, health maintenance. 3 to 6, you're trying to help with resistance of insulin, insulin resistance or diabetes. For more therapeutic, that's what these kind of things are. And then it says less than 1, difficult to achieve without doctor supervision. I would say if it's even difficult with doctor supervision, it's just a difficult number to achieve. This is not a pass-fail type of exam. This is, I'm still not there yet. I'm getting there. I'm doing really good. This is the ultimate goal. You may not achieve it, but that is the ultimate goal, is to have your GKI of 1 or less. So let's look at some examples of what this may look like in practice using actual numbers. Okay, so we're using milligrams per deciliters. For those outside of the United States who track in millimoles, just ignore this for now. So this is a blood glucose of 110. The ketones are 0.3. The GKI is 20. You're not in ketosis at this level. This could vary slightly. You could have 0.5, but you're just not going to be making ketones with a glucose of 110 because these have enough glucose in circulation. Insulin's going to be high enough to where it's going to turn off ketones. You're not going to be in ketosis. Let's say you lower your blood glucose to 95, your ketones rise a little bit to 0.8. Now your GKI is 6.6. You're kind of in a low, kind of borderline moderate ketosis. Now, if we lower your glucose from 95, 80, and your ketones rise to 1.5, now your GKI is 3. Now you're in a moderate level of ketosis, almost a deeper level of ketosis at 3. Then if we lower your glucose even lower to 70 and your ketones rise to 3.9, which seems a little exaggerated, but even if it was 2, it'd still be pretty darn good. And your GKI is going to be 1 with these exact numbers, right? So these are just kind of real world examples of what the math would look like if your glucose is high. So what typically happens is people are frustrated because their glucose is 100, 105, 110, their ketones won't rise. It would not be expected for your ketones to be high enough to have a decent GKI with your glucose that high. Not because you're a bad person, not because you're a failure. It just means that that glucose is too high. There's enough insulin, it's signaling that it's going to turn the ketones off. You don't need ketones at that blood glucose level. When your glucose drops, your ketones will rise a little bit, and your glucose drops even further, your ketones will continue to rise until you hit these thresholds. Let's look at it on a graph. Here is blue. This is glucose in millimoles to make things even more confusing. So now we're looking at millimoles. We're looking at apples and apples effectively for the measurements. Here is glucose in millimoles, 7, 6.5, whatever. You can see here that when those levels, the ketones will be 0. That is normal physiology. As your glucose goes down to a certain value, then the ketones will rise to make up the difference. Here's a GKI of less than 1, for example. Glucose is 2.8 or 3, and ketones are 6.5. That's probably not real numbers that you're going to see unless you're doing like a multi-day deep fast and you have good, not insulin resistance. But my point is this is just meant to be an example from a Seafried paper. Then you see here reduced compliance, right? Then you see how the ketones will immediately drop once glucose rises because insulin signaling, now we don't need ketones, and then we get back on the wagon, right? So this is the relationship. How do you actually check these things? You can use a spot glucose monitor. I just clipped out from Google Images, a couple of different brands. There's other brands. There are a whole bunch of different continuous blood glucose monitors. They can be extremely helpful for people, especially in the beginning, because you're getting continuous data on what your glucose is doing. And then in terms of the ketones, there are blood ketone monitors. There is no brand that is, quote unquote better than the other ones. It's just that there's different brands. It's a blood ketone, not a breath, not a urine, not some other part of your body. It's blood to blood, right? And this is, see how it's tracked in millimoles here, millimoles per liter. That's what it tracks in. That's why there has to be a conversion, because we have to convert milligrams per deciliter here in the States to millimoles. You don't have to do it. There are calculators that do it for you. You can use a Keto Mojo or this Keto BM now, where you have a ketone strip and a glucose strip, and then you get a actual GKI that will be calculated here on the Keto Mojo. I don't know if this Keto BM actually calculates a GKI. It may. It seems like it's trying to be a competitor to Keto Mojo. And then now they have the continuous ketone monitor. I've heard kind of plus or minus things about these things, how accurate, costly, etc. Even some countries, it seems like you can't even get it for whatever reason. Laws are at play. My point is there is now a continuous ketone monitor that you can get. So you could technically on one arm have a ketone monitor continuously. On the other arm, you could have a Libre or a Freestyle, whatever, Lingo. You could have this on the other arm and you could be getting literally real-time continuous data on your glucose and ketones. I do think for the right person, that could be a good strategy. And for other people, that could be, overkill. Maybe you just need a spot blood glucose monitor and a spot ketone monitor and you're good to go. Now, to finish off this talk about the GKI, about therapeutic ketosis, about how to track, etc., then I would reference this last piece of the Seafried paper that we were reading off of earlier. The zone of metabolic management is likely entered with a GKI value between 1 and 2 for humans. Optimal management is predicted for values approaching 1. The blood glucose and ketones should be measured 2 to 3 hours after a meal, twice a day if possible. I think probably the more data points you have, the better, but this is just their recommendation based off of this paper back in 2015. This will allow individuals to connect their dietary intake to changes in their GKI. As an example, figure 2 uses the GKI calculator to track GKI values of an individual on a ketogenic diet with a GKI target of 1.0. When the individual GKI falls below the dotted line denoting the target metabolic state, the zone of metabolic management is achieved. Further studies will be needed to establish the validity of the predicted zone of management. I will tell you that this paper came out in 2024 in December, and they're still recommending a GKI of less than 2 on average. Goal, always 1 or the lowest possible. So, that was 10 years later. They're still finding this GKI to be very valid, and they're finding this GKI to be very helpful. And the GKI, the lower, kind of the better. Again, I do not believe that a GKI of 1 is success and a GKI of 5 is an absolute failure. I think it's going to be a continuum. The more glucose you have in circulation, the more, substrate you effectively have, the more stuff the cancer can make with that, and the more signaling of insulin and insulin-like growth factor and all the downstream pathways, the more activation you're going to have of that. The lower the numbers, the better likely. But it's still going to have to be a discussion between you and your healthcare provider about what is the best level for you and your N=1 kind of personalized situation. If you like videos like this, please like, share, subscribe, and until next time.